What is the auscultatory gap? Have you ever wondered why blood pressure readings can sometimes be confusing? One reason could be the auscultatory gap. So, what exactly is this gap? The auscultatory gap is a period during manual blood pressure measurement when the sounds of blood flow, known as Korotkoff sounds, temporarily disappear or become much quieter. This happens while the cuff is being deflated and can last for a range of pressures, typically between 10 and 50 millimeters of mercury, starting at a point below the actual systolic pressure. Understanding the auscultatory gap is important for managing hypertension. If a healthcare provider does not recognize this gap, they might misinterpret the pressure at which sounds return as the systolic pressure. This can lead to an underestimation of the true systolic blood pressure, which is particularly concerning for individuals with high blood pressure. To effectively manage the auscultatory gap during in-office blood pressure measurements, there are some recommended steps. First, it is helpful to palpate the radial pulse while inflating the cuff. This technique allows the healthcare provider to estimate the systolic pressure by feeling when the pulse disappears. After this, the cuff should be inflated a bit higher before listening for Korotkoff sounds during deflation. This method helps ensure that the true systolic pressure is not missed due to the gap. Being aware of the auscultatory gap and using proper technique are essential for obtaining accurate blood pressure readings for individuals with hypertension. This accuracy is important for making informed treatment decisions and ensuring that patients receive appropriate care. Korotkoff sounds are the noises heard through a stethoscope as the blood pressure cuff is deflated. They help determine systolic and diastolic blood pressure values. The auscultatory gap is a silent or quieter phase within these sounds that can complicate the measurement process if not properly accounted for. Practical steps for managing the auscultatory gap include always palpating before auscultation, being alert for periods of silence during measurement, and repeating the measurement if there is any doubt about the results. These practices help maintain accuracy and support effective hypertension management. By following these guidelines, healthcare providers can ensure they get the most accurate blood pressure readings possible, leading to better care for those with hypertension.